Good morning, everyone. It's the Bob and Brad Mike live. It is what, Tuesday, February, the first day of February, the
Sure.
groundhog. I don't know if he saw his shadow or not, but we're probably going to have 6 more weeks of winter.
He did.
He did.
Yeah.
So that's good or bad.
It means 6 more weeks of winter.
Well, I guess it depends on your opinion if
Yeah.
it's good or bad. One way or another, we are going to talk a little bit about circulation, actually a bit about circulation, most from the knees down, the calves and the ankles. Do you have swelling there? Do you have it, is it lymphedema or is it blood flow? We're going to talk about all that. So you're going to get a complete education and how to actually correct it at home if you can. And then also there may be to the point you need to see a physician and have it looked at professionally to make sure it's done properly.
I do not mean to interrupt you,
Oh.
but on the screen right now is how you could sign up for any of our giveaways. We give something away every week. If you just follow this, it shows on our website where to go. And we are giving away the Thermatex Platinum model today. It is a far infrared heating system. That is actually a really good deal if you win that. They're pretty expensive.
Yes, they are.
They work great, though.
Oh, TikTok is up.
And hello, TikTok. We are live talking about circulation issues in your legs and ankles today, how to decrease swelling, how to figure out if you haven't been diagnosed, if it's more of a blood flow issue, if it's lymphedema, or other problems that may arise.
There you go. Yeah, so it's a beautiful day here in Minnesota. It's about 7.5 degrees outside.
Well, our cold spell is finally over, so it was.
Don't say that; it might.
It was
come
minus
back.
20 the other week, and it was 20 above yesterday. It felt like a heat wave.
That's true. That's very
true. We
true.
got people tuning in. We got someone from Florida. We got Debbie. Hello, Debbie. Feel free to comment or ask questions. We'll do our best to answer them. Some of them we can't really answer not seeing you or maybe beyond our expertise, but we will give it the old college try. Right?
There you go.
Good morning from Michigan.
All right,
Just
Michigan.
wondering, is circulation related to neuropathy or is it just nerve related? Neuropathy can be caused by circulation or diabetes or nerve issues. It can be numerous things.
We just did we did a video talking about that specifically, that question.
I don't think that new one came out yet, but
it's on the way.
And we do have other videos on it, though. We have Susan from Chicago, Joel from, the stuff's moving, from East Central Illinois, Oklahoma. We got Linda.
Oklahoma, where the wind goes. Well, I can't remember that song, but anyways, there's a movie like that.
Yeah, Danielle from, I missed it. It keeps moving. There's a lot of commenters. Hello, everyone. Hello, Maisie. Hello, Cheryl. Carla.
We are going to talk about
Jackson, Jean.
Compression garments, compression socks, as well as other options. Yes.
Leg bag inflators. I don't know what you call those things. Compression. Compression things. What are those called? I don't even know. Air compression massager. That's what it's called.
Actually, you've used them, so I don't know what the problem is.
I just don't know what they're called. I call them funny air boots. Anyway, so we're going to be coming live in the next minute here, talking about lots of different options. And we even have some visuals today. Good for us. We're working our way up here. Do you have anything else to? We got more people tuning in. Hi, Kathy and Victoria. And I put it in the other room. Why? He's grabbing the box. And the countdown is going down. We got our giveaway, which we mentioned earlier for this week. We also have our massage chairs back in stock because we sold out for a while. But if you are interested in one of our deluxe massage chairs, you can purchase them again.
There you go. They sold out over Christmas time, but I believe we do have more in stock now. So check them out if you're interested.
Boomerangs I love turtles. Okay. Do you love Ninja Turtles? I like the Ninja Turtles. Anyway, I was just reading the comment.
I like mud turtles.
What are mud turtles?
The painted ones.
Oh, well, our song's coming in, so we better be quiet, I guess.
Bob and Brad, the two most famous physical therapists on the internet.
Hello, we're live.
Yes, we are live.
Took a little while over there to get going, huh?
All right. Oh, we forgot to mention next week. What are we going to talk about?
We are having Adrian on, Dr. Tryan, talking about osteoporosis on our live, some bone density strengthening exercises and stuff like that.
That's right.
So,
She's an expert at it, and we're going to go over that in detail. So we've had a lot of interest in previous videos, so we thought we'd do a live one with that. So keep that in mind. We talked about our giveaway, and should we get on with the program? Yes.
Yeah.
So I really felt it was necessary. We're going to talk about swelling, pain in the legs below the knee. There's two big reasons why you can have swelling in the leg and poor circulation. Number one is arterial blood flow going down to the leg can be impeded. I'm not going to get into the details of that. Or the blood flow coming back in the veins or the venous return. Either one can be a problem. And then there's a second, and this is a big cause, and this is the lymph. The lymph is not blood. It's actually extracellular, and you don't need to know this, but it's fluid that flows around just underneath the skin. Now, if you have a healthy lymph system, that lymph fluid will flow up the leg, go through the lymph glands here in the femoral crease and back into the system. And it's a constant recirculation, just like blood, but it's lymph, not blood. And if that gets clogged up, then you have these lymphatic oversized ankles, and we're going to have some pictures of it and talk about that in detail too. So you need to know what you have, and it's going to help determine on how you treat it. Sometimes the treatments overlap, sometimes they don't. So should we get on with that?
Yeah, I just want to note that this can happen in your arms as well. We're just going to be talking about the legs because it tends to be more common in the legs unless you've had some sort of arm injury, but the same principles kind of apply to your arms as well.
All right, so first thing, we're going to talk about the three different problems: arterial supply, venous return, and then the lymph. And then we're going to actually show some pictures of what each one can look like. And that's going to help you understand so that you may know what you have if you're having some of these problems. The first one, arterial supply. In other words, your artery going down. If you have plaque buildup, all those things, that can be a problem. So the things that can happen is you get increased pain in your foot. And this is one of those things I'm very familiar with because my father had it, and he would do fine. His legs were a little on the blue side, but when he walked, he'd go maybe 200 to 300 feet, and all of a sudden his feet would start to ache and painful. And he described it as it felt like his arch was breaking down. And I knew his arch was okay. And I tried to explain to him it was blood supply thing, but he never did really get a hold of that. He was convinced his arch was breaking down, but it was a blood supply problem. And then you want to talk about the venous return, Mike?
The venous return is what brings your blood back up your leg into the heart. So if that is problematic, oftentimes your legs can look kind of shiny or even tight. You may have some swelling as well. This could be lymphedema or not. Sometimes there's overlap between both of them. It's not necessarily just one issue or another. You may also have some visible veins or varicose veins, we call them. And your skin is normally warm. Or can feel hot. It's not cold. If you have poor arterial flow, oftentimes you are cold, more pale or bluish. If you have venous insufficiency issues, it's more warm or hot. Sometimes even red.
Yeah, this is one of those things that it can vary. There's a little crossover, but when we see the pictures, I think that'll help clear that up a little bit as well. And then again, the lymphatic problem where the fluid and it's superficial. It's not deep in the leg. It's underneath the skin. The lymph needs to go back up again through the vena or the lymphatic system where you get, that's part of filtering out the lymphatics to keep the bad stuff out of your body and just get rid of it. And the lymph is where the feet will actually blow up, and it actually can look like a balloon in serious case. We'll show some pictures there. As a matter of fact, Danny, let's go up to the actually the first one.
Let's go to the bottom left.
Okay, the bottom. Yeah, that's a good idea.
Dan, which one do you want?
That one's good.
Okay. We're cooking on this one.
Oh, so this leg, if you look at it, has some redness in it. It has swelling in there. I think this could be a combination of two of them. One thing's for sure is I would say there's some lymph in this. You can see how it's swelling around the ankle and it's tight. It's a little bit shiny. But the big red flag on this one is the redness. Now, if you were to touch that red area around the ankle and it start feeling really warm and hot, that's a red flag. You need to go in to see a doctor. You don't want to continue watching this and try some of these treatments that we're going to show. You need to get it treated. And that's why I'm showing some of these.
Let's go to this one. This one is actually a picture of what edema looks like. So this is specifically pitting edema. You can see they're putting the finger into the leg, and you can see on the 1 foot indent stays there. If your indent just stays for a second or two and color comes back, it's probably not pitting edema. However, if you do that and it stays there for, it can be 5-10 seconds, it could be a minute sometimes if it stays there for a while.
And if you have someone that is real familiar with this treatment, you have to hold your thumb in or your finger in and press it in for a certain amount of time, and then they time how long it takes for the indent to come out. And there's 4 grades of pitting edema. We're not going to go into that, but grade 4 is the worst one. This one is pretty bad. If you have pitting edema where you put your finger in for 10-20 seconds, you pull it off and it stays like it is on the other side, that's pretty bad. You need to not do things on your own and go see a doctor and have it treated professionally and make sure you get on the right track, because you can treat this and it can get better. I've seen it many times.
Here's another picture of poor circulation issues. So this one you can see they have very dry skin. So sometimes just using a moisturizing cream can help. However, it looks like they may have a little bit of, they don't really have much swelling.
No. This one I put on particularly whether you have swelling or not. The dry, flaky skin is a red flag. And the reason I know this is because my mother had this exact same symptoms, and she ended up getting an infection that went through the dry, flaky skin, and she got sepsis. It was very serious. It was actually life-threatening, and it was all because she let her legs get too dry, and all they needed was some simple lotion. You can call it the doctor's nurse, and they'll let you know what you can put on there. But it was over the counter, actually, all she needed, just to keep the skin moist so that seals and you don't allow bacteria and things that can cause infection through the dry skin. So that was the big reason I put that one up.
So some of the tips we're going to go through in this video are not necessarily exercising. We'll show a little bit at the end of the video, but most of them are just general tips of things you can try out. Some of them you definitely want to check with your doctor first if you have these issues, because they can be very serious, and you want to make sure that you have someone in the medical professional realm working with you on this to make sure you're doing things right. Obviously, we're not going to talk about it now because it's not our scope, but diet definitely plays a big role in circulation issues and swelling and lymphedema as well. So that's something to look into. But our first tip is just talking about different types of compression options you can use. The first one is wraps. If you have lymphedema, oftentimes you will go to someone and they'll probably show you how to wrap or have someone wrap you. They use, sometimes they use Ace wrap still. Sometimes they use, it's called Comprilan wraps, Comprilan. Tanner, if you want to zoom in on that, they can see it. They're relatively inexpensive wraps. You normally want to buy a couple of them for each leg, depending upon the length of your leg and how much swelling too. You might need more of it, but they are you normally don't machine wash them. You normally just soak them
or hand wash them, right?
Yep.
And then dry them up on the line. Don't put them in the dryer. I'm going to show this now. I'm going to say that this is something you probably do not want to do by yourself. There's a certain amount of skill once you get instructed how to do it properly, and then it takes some practice that you can do this properly. Why don't you put your leg up here once, Mike?
Yeah,
so
it takes a while. I remember in school, it took me a while to get it done right.
You have to have it rolled up properly, and then you have to put it on the right way. If I do it this way, it's going to work. If I do it this way, it's going to be really awkward. So you're going to start out here, and this is 3 or 4 inches wide, and you have to have some experience and education on how wide should you use. Comprolon is typically used with edema. If it's just swelling, then ACE wrap is more common. And then
normally you want a 50% overlap each time around that you go.
Yeah.
You also want to make sure it's not too tight. You don't want to cut off circulation. Notice that I'm having my foot in a nice neutral position while he's doing this too. I'm not down too much. So there's a lot that goes into it, and trying to wrap it so it doesn't get a bunch of bumps in it, because oftentimes the swelling can pocket in that area. So
right. And like Mike said, you want it a little tighter at the forefoot, and as you go up, looser and looser, so that it allows the circulation to go forward. Again, we're going through this very quickly on this video. This is something I think you need to have instruction person to person with, unless you've done some of it before, but it's a skill. You have to know how to do it, and then you have to practice it. Anybody that does it good has done it many times, and then you get good at it. So learn from a professional, so that you get to feel how it's supposed to feel, and then maybe you can do it at home. It's hard to do it yourself. You can, someone else really should be doing it. It's much easier. So I just wanted to kind of bring it up and not teach you how to do it here, though.
Yeah, the big difference between Comprolon and ACE wrap is just kind of the material and how it works. There's not a whole lot. It's more, this is a little bit thinner. I mean, width wise in comparison.
The way it stretches, it doesn't have as much compression.
Sure.
Lymph, when you're doing lymphedema, you don't want that much compression. It's actually, you would think you want a lot of compression. I always thought you needed more compression when I came out of school. Then I started to learn about it. It's like, oh, I was thinking wrong. Anyways, it is, wrapping for lymphedema is a specialty. You should see a certified therapist in lymphedema if you really want to get excellent treatment for it.
I have a quick question I can answer.
Oh, yeah. What do we got?
So Julie says, if you remove a sock and the imprint remains for quite a while, it's very interesting. But yeah, that can be a sign you have swelling in your legs. If you have an indent from your sock line. So if I just took my sock off and I had a big indent for where the top of it was, that's a pretty good sign you have some inflammation or swelling in your legs.
Yeah, we'll cross that a little bit more. We're talking about and wearing compression socks, and you get that tourniquet effect, and that's going to be exactly address what you're talking about.
I think we'll get into that now.
Should we?
Yeah. So
excellent.
Another option are compression socks. If you are diabetic, you may already have some from your doctor. There are medical grade ones. They measure your leg, get you the right size for them, and kind of teach you how to put them on, take them off. Sometimes people with edema will wear them as well. Sometimes they're almost whole leggings, depending upon the type, but they are a good option for leg swelling, but you have to work with your medical professional. If you just think you have some mild poor circulation, and maybe you're younger, you could try some compression socks. There's tons of brands out there. We're not really affiliated with any of them. Typically, you just want to find ones where distally there are 10 millimeters of mercury of compression, and then typically 20 up top as it gets towards your calf.
Other way around.
Other way around. Oh, well, you wrote it that way.
I know. Don't go by that. Go by this. It's got to be tighter down by the
so
foot.
You want 20 and then 10 up top.
Yeah, so that it pushes the fluid up. Sorry about that.
Brad typoed
I'm
me.
not a very good typist there. But yeah, and compression socks should go just below the knee. And the one thing about compression socks is Mike, he's doing pretty good at it.
They're work to put on because they're tight.
Yeah, they are. You got to make sure the heel goes in the right spot. So
yeah,
it works.
You got to finagle them on right. Sometimes they have a specific left and right as well. But get them on, and then you got to pull them up and work them up. And there we go. I like them for like recovering after workouts, or sometimes if I'm doing a lot of like running. Sometimes I even wear them during the run. Obviously not during sunny time of year because I'd have a really bad tan line. But they definitely help with increased circulation and bringing blood flow back up from your feet.
This is one of those things that, again, like Mike said, if you're healthy, you've got a little swelling, maybe you're a walker, you're a runner, you can wear these quite a bit to help make sure you get the blood flow moving up and everything stays healthy. There is one problem that can be caused with these, and well, I'll tell you what, I'm going to show you before I get into that problem of the tourniqueting, to avoid trying to get these on like Mike did, and he did it pretty good actually.
I have practiced.
Yeah, my parents, they were going to wear them, but they were so hard to get on. They just said they weren't going to deal with it, and that was before I knew about this. This device here makes it really easy. You just have to know how to put it on properly. The heel goes towards you, and then you just bring this over the top and slide it down, and beep, beep, beep. And you got to make that noise. Beep, beep, beep. There we go. Got to go all the way till the tip of the toe is right here. I can feel the bottom right there. I'm going to go a little bit more. Grab it like this. Put your toe in that little thing where I put my finger and slide your foot through. Pull up, pull, 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 pull. And there we go. Now, if you have the proper length compression sock, it should end right here. Now, this is a good example. It is actually too long. If it goes up over the knee like this, it's a problem. It's not necessarily a problem right now, but it probably will lead into one, because what happens is these will roll down and you get that tourniquet, just like the viewer mentioned before. And two things happen with this. Well, number one, it's not very comfortable. And one of the reasons it's not very comfortable is because it's tight. The other reason is it absolutely contradicts the reason for wearing it. It puts a tourniquet effect around the leg, and the fluid, your lymph, cannot go past that. So you're actually making your lymph worse if you have this happen. Now, one thing you could do is double it up so it's not a tourniquet. So now I've spread that out over this wide. This would be okay, better than a tourniquet, but the best thing to do is get the right length of sock. So when you pull it up, it's there, and then it's good. If it does continue to tourniquet and you have a problem keeping it up, what you can do is get something called Coban. It's a tape that's unique in that it doesn't stick to your skin, but it sticks to each other. So what you do is you take this Coban, I'm just about off on this one, wrap it around, and there's different colors. This happens to be camouflage.
You can find Coban anywhere.
Yeah.
It's not
and it sticks to itself. And then you don't put it very tight, because you don't want that tourniquet, and it will stick and stay very well, and it doesn't have to be tight. So a nice option to keep your socks up, and it works really well. I did want to mention one thing. I wore these. You can wear these in airplanes if you're sitting for long periods of time, like Tanner, we were just talking about flying to Australia, because you're sitting for a long period of time, and particularly if you're a little older, these can help the circulation in your legs in a seated position where you can't get up and walk very much. I did this on my way to Alaska, and mine actually tourniqueted. I think I might have had these on because they weren't the right length. By the time, after 4 or 5 hours of sitting there, it was so uncomfortable here, and I couldn't get in there because my pants were down in the airplane, etc. So I had personal experience with uncomfortable fitting socks, and getting them off is a little hard, but not too bad.
We had an interesting question. What's the difference between lymphedema and lipedema? Well, lymphedema is your lymphatic system. It causes swelling if your lymph nodes are not working well. They based off your lymph nodes. Lipedema is actually adipose tissue buildup genetically around your hips and legs, which is just essentially fat cells.
Sure.
So they're totally different systems. They're just kind of spelt similar and have edema in there. But yeah, that's the differences between them. How do you spell Coban? Just like that. You got it right.
Excellent. Must be a
Coban. I put it on the screen. They can see it. I clicked on it. They can see it.
They can see that, huh?
Compression socks or stockings are also great for long flights. Yeah.
Yeah, we just talked about long flights.
A non-concerning lump behind your knee are compression socks not recommended. I guess if your buildup of fluid from the compression socks goes by your lump and it makes it more uncomfortable, then no. But I don't really have an answer.
Whoever diagnosed the lump behind your knee is
better person to ask.
Yeah, for sure, because it's hard to say without knowing.
Another option that's a little bit cheaper and easier to put on is Tubigrip, which we have right here. Brad has. Oftentimes it comes in a roll. Sometimes you can buy them pre-cut if you only want a couple of them. You just have to measure what size you need. There are lots of different sizes of these, so you definitely want to get the right one. But you actually have a video of this.
Yeah, absolutely. This is a classic video of Bob and I, how to actually size Tubigrip, cut it and put it on properly. So when Danny's ready, he'll pull that up, and yeah, I talk about the sizes. Oh, he's got the thumbs up. Okay, let's take it away. They're comfortable, but I got to get them on, get them off, so I don't want to do it.
Right.
We're going to show you an option that both Bob and I have used probably at least for a decade in the clinic, and that's and it's much cheaper.
Right.
It works well, and it's called Tubigrip.
Right.
And what it is, it's a material. And it's an advantage to have open end. And
Right.
we'll talk about that in a little bit, but it stretches only one direction. It doesn't stretch this way, but it stretches the other way, as you can see.
So it gives you some compression.
Yep, and this will give 10 to 15 millimeters of compression, which is typically what you're looking for when you start out. You don't want to start it out too tight. So it's a great garment. We got good experience with it. And so shall we go on with
why
it?
don't you show how to put it on me?
Again, we're talking about swelling. Could you get your foot up there, Bob?
Sure.
Now, obviously, Bob does not have any swelling, but if we're going to imagine, typically a swelling...
Probably some smelling.
Yeah, smelling exactly right. Whoa. But the foot will swell in the forefoot, around the ankle, and oftentimes all the way up into the calf.
Yeah.
So we want to have the garment from here, not over the toes, but from the base of the toe line to just below the knee.
Gotcha.
Okay? Now, first thing you need to do is get the right size.
Right.
And this will come in, they put it in letter sizes, A, B, C, D, E, F, G, I think up to H or something of that nature. And with Tubigrip, go to tubigrip.net. And you're going to come up with...
.net.
Yeah, exactly.
Okay. Yeah, you're right.
Yeah, that's what I put on there. And you're going to see a chart down there, and they ask you to measure with a tape measure around the widest part, which oftentimes it could be the calf or it could be the ankle. Measure that, go to the chart.
I got a question.
Oh, yes.
It always comes into 10 to 15 millimeters of pressure?
Tubigrip does.
It does,
Yeah.
okay.
You
So it
can
does
double
come-
it and you can get more.
Sure.
And there's a little point I want to add about that.
Okay.
So you'll measure it, and I believe, what is this?
So you're measuring
This
from...
is for my mother, actually.
Right.
And hers came up as size F.
Okay.
Okay. So I got the size F
So
here.
you measure at the widest point,
Right.
biggest girth
Right.
of the calf.
And in her case, it's around the calf. You know,
Sure.
if it's a swollen ankle, like if you had a big swollen ankle, you would measure it there. You can visually see her.
Oh, the biggest point.
Yes.
Okay,
The largest circumference. There
Okay,
we go.
gotcha.
Now you'll see. Don't get confused, because it confused me. On Tubigrips, they say double this up. Put on one layer and then put a second layer over the top. So I had to go to, we have a therapist, a doctor of therapy.
That works on this all the time.
Yeah, and he took the full course, got certified in it. I would consider him an expert. I got a hold of him and I said, now, Aaron, and we've got some videos that are well liked by him. Do I put 2 or just 1 layer of the Tubigrip on there? And he said 1. Start out with just 1, and for the vast majority, that's going to be what you want. So don't get confused by that.
Hi, we're back. You're still muted. You probably want to unmute yourself. Anyway,
hello.
We had a question about where you got that sock aid from. Here's a link Chelsea put up.
Oh,
for us.
thanks,
If
Chelsea.
you're looking to find the one, I'm guessing you're talking about the metal cage thing.
Yeah.
Yeah.
Work really well. They're nice.
One thing we want to talk about with compression socks is that you want to make sure, if you are diabetic, to get one. What do you call it? No.
It has to be seamless, and particularly look at this sock. I don't know if we can zoom in, but there is a seam and a crease. It's like a little.
It's so much black on black.
Yeah, there's a bump there.
It's kind of hard to say. You could see a seam line. it's kind of hard to see on camera, but there's a big line you can obviously see. And if you are diabetic, you want to try to get seamless ones.
You don't want to try, you want to
You
get
want to get
seamless. Yeah.
seamless ones.
You can get there is a company that's called Smooth Toe, and it's because the toe is smooth. Now this one is not smooth toe, but the seam is very minimal. And if you do have a seam and you're diabetic, you realize that could put a compression spot in one area and actually break down the skin and have a sore. And you know what, that's very, very bad for someone who's diabetic, because it may take a long time to heal. And actually I've had people have amputations as a result of having one little spot, like a toenail clipped or something of this nature. So be sure, if you're diabetic, you get the right kind of sock.
I don't think I have a good answer for this, but what was your recommendation on compression socks for painful shins when walking? Some of it could be caused by your walking pattern. Some of it can be just weak tibialis anterior or front shin muscles. Or I'm not sure, Marilyn, if you just got into walking, if you kind of have shin splints, you can try compression. I mean, if I've had sore muscles, it kind of takes some pressure off of your leg muscles. It's more your calves I feel it in than my front shins. I can't guarantee it's going to help you or not, but
I think she could try them if she's healthy and doesn't have any problems. I know a number of people that wear them because they like them. They feel they get better circulation. My friend did it because he stood all the time at work. He had pain in his was the calf, but when he wore compression socks, things felt better. He felt he had better circulation. So get the proper size, and the lowest compression is going to be the 20 or 15, and then the 10 millimeters of mercury is how they measure that. So yeah, go ahead and try it if you want to. I can't guarantee it's going to help, but it should not hurt anything.
So I have a big funny thing on my leg, which is probably hard to tell because my pants are black, but this is also black. So this is a air compression massager. So this one, I honestly don't even have a brand name on it, but there's lots of different companies that make them. We're not affiliated with any of them, but they're more of a nice recovery device. So what they do is they inflate. So you can see it's starting to inflate distally on my feet, and then another bladder will come around my shin level and work its way up to my quad region. And this will kind of go pneumatically for however long you have it set up for. But the whole goal is to push circulation distally from your feet back up into your system to help with any recovery. Now, these are more tailored, this specific type, for recovering from like athletic endeavors, recoup faster. This one's not made for like lymphedema. There are medical grade ones where if you actually go to a center and see someone, they have them set up. The people are trained on how to do them properly. And some of those may even be, this is a wireless one. They're typically connected to tubes or they have an outlet. But some people with lymphedema do see some benefit from having some type of compression massage like this.
Yeah, exactly. So again, if you have any of the symptoms like in the pictures we've shown, you could benefit from some compression garment like this, but you're not going to buy it online and just try it yourself. You've got to see your doctor. They should send you to a certified lymphedema therapist. Then they'll evaluate you and see if you're a good candidate for these, and then you'll get, they'll put them on and see how you tolerate them. You can get yourself into trouble if you push too much fluid up your leg. If you have lymphedema, the fluid goes up into your trunk and you get too much fluid, and it can be a problem. One of those things where you need to go to the hospital. So this is one of those things you don't want to play around with. Get proper treatment if you've got that particularly pitting lymphedema.
Yeah, if you just have some mild circulation issues or you're just pretty active, like these are probably fine for those scenarios. But anything more serious, you don't want to try that on your own.
Right. Yeah, I've worn these and they do feel good. If you walk a lot and you want to get your legs some relief, you don't have to be a marathon runner to get benefits from them.
I just don't have the other one on. They normally are sold in pairs. Some are wireless. They're just batteries. You recharge them. Some are wired. This one, I personally like the ones that are all one system. Some do sell them separated, between foot, calf, and then quad, and there'd be some gaps in there. But they are handy. They do work nice. I don't know if I honestly notice that much difference after wearing them. They feel good while you're wearing them, but oftentimes if I just go for a walk, I'm going to get blood flow and circulation in my legs and I'll spend money, but they do feel nice. All right, what is our next topic here, Brad?
Well,
Oh, do you want to talk about the lymphedema massage techniques?
yeah,
Okay.
yeah, a little bit.
This is your realm. I'll let you talk.
You mean the manual massage?
Yeah.
Actually, you know what happened? I thought Aaron, who was our certified therapist in that, we had a video on that. We have it for the arm from him, but not the leg. I'll talk about it briefly. And if you do go see a certified therapist and you have lymphedema, swelling problems, and they're going to say you need a massage. Can I see the leg wedge? What you need to do is use gravity. Number one is going to help. It's kind of a strange massage because you're going to think, well, I've got swelling down there and I need to get the fluid to move up. You're going to start massaging the leg and kind of work it up this way and have it get up through the lymph nodes and then into the trunk where it needs to go. But it's the opposite. You cannot really do this to yourself. I'm not going to train you to do it here. I'll just give you an idea of how it works. And then you'll need to go see, a doctor, and they'll refer you to a therapist that really knows how to do it. And I've seen it work firsthand. My mom had bad lymphedema, and within a week and a half, things started coming down and actually less than that. So you start out at the trunk and you actually do a really light massage. And again, I'm not going to give you an exact instructions, but they start up here massaging here, then they'll massage the leg here on both sides, assuming you have lymphedema on both legs, and then you end up working your way down to the foot. And you think about it, water going through, and say there's a dam right here in your femoral crease and the fluid cannot get through there. You first have to open up that dam here, and then the fluid can start to go through there. This is just an analogy. It's not exactly how it works. And then you work down, forcing the fluid up. And it's really interesting because once the massage is done, one key thing that you've had a good, successful massage is when you get up, the first thing you say is, I got to go to the bathroom. Because what has happened, the fluid has come out of the legs into the trunk, and it goes that fast, it'll get in through and into the bladder, and you have to go to the bathroom. That was the first thing to happen. My mom, she says, I got to go to the bathroom. And the therapist said, we're right on, things are going well. So keep that in mind, but don't try to do that to yourself. It's too complicated. It works best with someone else until you've been assessed. Maybe you can. So there you go. It's a very interesting treatment, and a lot of people don't understand it. So I hope that gives you just some good background on it. The other thing you can do about circulation that you do similarly is in your bed or on the floor is simply use elevation. And if it's that serious case, you might be able to just elevate your feet. Oh, want to throw me a pillow or two?
Maybe.
And there's a few ways to elevate your feet. If you don't have a leg wedge, that's okay. You can simply pile up a bunch of pillows. I would put up leg wedge and more pillows, but otherwise just pile up a bunch of pillows, maybe take a cushion from the furniture, elevate it so gravity starts pulling the fluid down, and that can be helpful. And that's maybe if you have a mild case, that's all you'll need to do. Exercise, of course. And while you're lying here, definitely you got to do ankle pumps. We talked about not exercising, but there's only so much you can do without exercise. Ankle pumps while you're elevated, so the muscle contracting is forcing the fluid down, plus gravity is pulling it down. So it's a 2 for the price of 1 there, and that can be helpful. What do you got there, Mike?
So for some people that have more just circulation, cold feet issues, foot massaging can certainly help with that. If you have lymphedema, I don't think a foot massager is going to help because you have to adjust or look at your lymph nodes. But if you just have some poor circulation issues, foot massaging can help. Oftentimes these have like a form of compression to them, heat to them if you're dealing with cold feet as well. And it just massages the muscles around it, which isn't necessarily related to circulation, but it certainly feels good.
Well, I got to tell you, I have one of these at my workstation at home on the computer, and the basement in our house does not have a good heat source. It comes out of the ceiling, and I'm cold down there.
So that's your heat
And when I
source.
use this, my feet do not. Well, my feet get cold easily anyway. So if you're one of those people that get cold feet easily winter time, I tell you, this really works well. It gets the heat source in there when I use this, so it works well. I just put more socks on and that kind of thing.
Barbara Finn asked, would you recommend a massage gun? The massaging for swelling and circulation is different than a massage gun massage, if that makes sense.
Yeah. You've got a massage. If you're healthy and you're walking a lot and you want to massage your legs with a massage and you don't have swelling, you just feel like maybe your muscles are tight and the circulation isn't there, you could use a massage gun.
I could quite mention this. Oh, it's not popping up on screen. Pop up on screen. What's going on? The internet went down?
It keeps stalling out.
Oh. I was gonna say, like, I can't click.
Well, don't leave it on there.
Hello. Oh, I think we're back. Our internet decided to cut out again. We have really nice internet. Anyway, just let us know in the chat if everything seems okay. But we're gonna continue on. So we're talking about swelling, lymphedema. I don't know where we were when we were talking.
I do. Go back to we'll figure it out.
We're getting our system back up here. Shoot. There it is.
Yeah, so we were talking about a little bit about massage, foot massager. If you have some swelling in your ankles and it's mild and you're functional, there's no pain, you could use a foot massager like Mike was demonstrating. Again, the massage gun, you're certainly not going to use a big gun like this at all. If you were going to use a massage gun because you had mild swelling, no pain, you just want to get circulation, you could use a small gun like this. These are really nice anyways, actually pretty powerful. And they got these heads now that they're actually heated or cooled, and they'll go up to 114 degrees, nice warm head. And again, put it on low setting, and it's not aggressive. You could certainly massage there. If you got the heat on, you'll want to get it right on your skin because you'll feel it. Mostly the calf. You don't ever want to use these over a bone. It's always over muscle. Tendons, okay, like the Achilles tendon is a big tendon. You can go over that. But typically, if you get to a tendon, you're getting close to a bone. So these are soft tissue devices. You could also use this on the bottom of your foot, which I like to because it feels real good. Get some motion and circulation going in the bottom of your foot. But again, it has to be comfortable. If it hurts, it's way too aggressive. A small one that doesn't have a lot of amplitude can be used as long as it feels good. I like to do it over the sock because this has a smooth head and it actually slides over my foot really nicely. So limited use for circulation, the massage gun itself.
Debbie had a question. Hopefully you're still here, Debbie. This is earlier. Since my knee replacement, I get a lot of fluid from knee down to foot. That's very common, especially early on, even like for a year afterwards, just because the circulatory system, the lymphatic system are all kind of affected for a while after a major joint replacement like that. So just kind of keep that in mind. It does often get better if it's been like numerous years then you may have some compromised circulatory issues. You may want to get checked out if it's a concern for you personally. But if it's more recent, that's very normal, especially if you start doing more activities. You're right in front of the camera. Yeah, there's 123 people watching. So
I just wanted to make sure people were still watching.
So some other things that are important. I know we talked about things you can do without exercise, but exercise is really good for circulation and swelling because it gets fluid moving, especially distally to your feet. Obviously, you have to do exercises that involve your legs in order to get the circulation there. So we're just going to go over some basic things you can do. We'll start with more seated position stuff for those of you that have more issues doing them standing, and then we'll do some standing ones as well.
Yeah, and I know it sounds old-fashioned, but getting back to the basics, exercise is really your first option, particularly coming from a therapist. The other things are really helpful, and when you're not exercising, or some people don't have the ability to exercise for maybe joint problems, who knows what kind of problems you may have. But as you can see, Mike, this is a great seated exercise. We call these long arc quads, or just kicking, and then he holds it and then he pumps the ankle a few times. The muscles throughout the foot and the calf are working, and they actually create a pump forcing fluid upwards to the trunk where it needs to. What are you doing, Mike?
Hey, look at Karen.
People don't want to see your legs.
So I'm showing you my foot so they can see the leg a little better.
It looks a lot better than my leg.
It's a lot of dark. Anyway, this is the basic thing you can try is kicking out and doing some ankle pumps at the top. Then we're going to do some marches to work its way up. So we kind of hit the ankles and the quads a little bit and the hamstrings. So you can just kind of do some marches. You can do this laying on your back too, like Brad is doing.
Yeah.
So you can do kick-ups like that. Ankle pumps, you can certainly keep your legs straight and do them. You can even ankle pump like this, just in a chair too, just going heel to toe rocking. It's kind of an ankle pump. Oftentimes a calf pump, your calf muscle engages by pushing down. It can help with circulation issues, especially distally. And then
I'm doing the bicycle, Mike.
I see that.
This would be hard for
bicycle.
some people.
Yeah, just getting your legs moving whatever way. I'm just doing some marching now. Some marching to work up in your hips more is a good option as well. Just some things to help move.
There you go. Yeah, so in bed, before you get out of bed, you could certainly do your ankle pumps here, do your long arc, your kicks with the pumps. You know, a lot of people may not be able to do this, but it's good for core exercise as well as elevation, gravity, and working the legs all together. And you could do a bridging exercise like this. This won't work below the knee so much, though, but it's still a nice exercise to do a little bit before you get out of bed.
Gary said he had issues with his left leg, was swollen, hurt to walk, wouldn't stand. His treatment was exercise and losing weight, and it paid off. He lost 80 pounds and feels much better, and his leg pain is history.
Oh, excellent. Nice work. Boy, yeah. That is
job,
right from the gut. You know, the old saying is if it was easy, anybody could do it, and he really did a nice job at that.
Now we're going to get into some standing ones. So again, we're going to do some similar exercises. Hold on to something for support if you feel unsteady. If you feel steady, you don't have to. You can use a chair, countertop, railing, stick, whatever you have available. So just doing some marching first. So just kind of what I was doing, but standing.
I should have wrote this in, but actually probably up and rocking up on your toes just to get the ankles and the feet muscles working first.
You do have that, but you put it number 2. So I was doing number 1.
Oh, yeah.
Brad likes throwing me off today on his documents.
Yeah, I don't know what was wrong with me.
I don't know either. So we can do some heel toe rocking to get the ankle pumps. It's going to be a little more challenging going up on your toes because you have to move your weight if you are weak or have some calf issues. So certainly if seated and laying down is easy, you can do them standing. It's a good form of exercise. Then we can get into marching like we were talking about. Just get the hips moving, the knees bending, just getting some circulation going. You can certainly don't have to face the chair so you don't feel like you're going to knee it hard. But just take your time, works on your balance a little bit too. And then you can do some sidestepping. What are you doing? running
Just
away.
relax. You just keep showing. I've got a special little
So we're going to do some side
treat.
stepping. If you have balance issues, you can certainly hold on to a cane or stick or your countertop in front of you and go along your countertop in your kitchen. Just do some side stepping to get your legs moving. These are kind of a double whammy because it gets a little bit of balance work in there as well if you are struggling with being on your feet. Because if your legs hurt or you have a lot of swelling or inflammation, just moving around standing like this can be troublesome. So it's good to practice getting a little steadier on your feet. Then we have some big mini squats, or you could do sit to stands. So Brad's already in a chair, but you could sit to a surface and then just stand back up. Mini squats you could certainly do like this and go back up. I just feel like people, if they've never squatted in their life or they really struggle with it, they often do really weird things. So I just have them sit in a chair and stand back up, work similar muscle groups.
Yeah. 10 to 15 of each, and you'll be done in a few minutes. And do those about 3 times. Issues, joint issues, whatever it may be. There's devices you have. This device here, it's called a Fit Glide. Actually, Bob and I invented this. It works really well for after knee surgery. It works well for people who are unable to exercise standing, because you simply, if you're in a wheelchair, your knees are really arthritic and it hurts to stand, or anything where weight bearing is painful, and you want range of motion in your ankles and in your knees. This works really well. You do this. I've done this for 5 minutes straight. It's like, well, this is kind of harder than I thought, and I don't have any problems. We do have another option. You can actually tilt it up. And there's a big,
The internet's slowly going out again.
Oh, we've got an internet issue again.
Well, we refreshed our internet again. Hopefully it's back better and not glitchy, but we'll keep going and wrap it up soon. But the Fit Glide we're talking about, you can adjust the angles, go to incline or a decline, an option where you can stay in your chair if you don't like being on your feet too much and just get some circulation. If you go to a gym, certainly a stationary bike is a fine option too, or those little pedalers you can have at home. Or any type of just movement in general. Walking's good if you are able to walk and feel comfortable doing that is a good option as well.
I do want to mention, are we on, Tanner? The big advantage of this is one of them is, can you move, Mike, please?
You can do it laying down.
Yeah, you can use it in bed, after a surgery, or you're not able to get out of bed, but you want some leg exercise. You can simply work it here and get some mobility, circulation, exercise in the legs and the hips. So, and it's really light. It only weighs about 4 pounds. It's light that you can clean it easily. It works very well.
Well, before our internet gremlins come back and kick us off again, I think we'll wrap it up there. We'll be back next week talking about exercises for osteoporosis.
There you go.
Strengthen your spine with Dr. Adrian Tryan.
Yeah. So bone strength, get those bones stronger via exercise. We'll talk a little bit about nutrition, not too much, but we'll touch on that. It's not our specialty, but they work together.
Just don't call me a bonehead. Anyway, thank you for watching. We apologize for our internet connection today, but you could certainly rewatch this on YouTube anytime or Facebook. Rewind it, fast forward, skip around. And yeah, in case you missed something.
Very good. Have a wonderful day. And, it's going to be warm by April. I can guarantee you.
I don't know what the groundhog said, but okay.